Welcome to this Sabers Medical Provider Spotlight. We're highlighting individuals doing really important work in mental health.
Hmm.
Today, we're diving into the work of Nicholas Goodwin. He's a psychiatric nurse practitioner, founded Goodwin Health Cafe up in Spokane, Washington.
Yeah.
And our goal, really, is to get his perspective on mental health treatment, especially how he brought transcranial magnetic stimulation, TMS, into his practice.
Yeah, it's a really interesting journey. So looking at his background first,
Let's do it. He's clearly got deep roots in the field.
absolutely. He got his nurse practitioner degree and then also a doctorate in nursing practice from Washington State University back in 2019.
Okay, so advanced training, that's serious commitment.
Definitely. And before that, or maybe alongside, he spent 5 years as a psychiatric nurse in a state hospital.
Wow. That's intense exposure, right?
Yeah.
You see a lot there.
You really do. Complex cases, challenging situations, it builds a strong foundation.
And he didn't stop there. Experience teaching psych nursing, too.
Yeah. Teaching undergraduates suggests he really knows his stuff, foundationally speaking.
Plus, work in adolescent residential treatment, mental health, and substance use.
Right. So that adds another really crucial dimension, you know, working with that specific age group, the dual diagnoses.
It gives him a pretty wide lens on mental health care, doesn't it? Different settings, different populations.
Exactly. That kind of hands-on experience across the board, it must really shape how you approach treatment.
Which kind of leads us nicely into how TMS came into the picture for him. It sounds like it started with something else first, esketamine.
Spravato.
Yes,
Yeah.
exactly. He brought esketamine treatments into the practice and found that was a really positive step.
Yeah.
One thing he specifically mentioned was the benefit of needing those regular in-office visits.
Ah, interesting. Why was that so key?
Well, it meant patients had consistent contact, same staff, regular check-ins. It helped build sort of a supportive environment.
Right, that makes sense. And it sounds like the success he saw with esketamine sort of opened the door to thinking about TMS. Yeah, it seems like a catalyst. The positive experience with one in office, procedural treatment, likely made him more open to exploring others.
So what specifically drew him to TMS then?
Well, a few things. The fact that it's non-invasive was a big one,
Yeah.
and drug-free.
Okay.
That's appealing for a lot of reasons, especially when you consider the efficacy rates that have been reported for TMS in treating certain conditions, like depression.
And that in-office aspect, again, similar to esketamine, he seemed to really value that. You mentioned the environment, but he also talked about compliance, right?
He did. Because you have to come into the clinic for every single TMS session. It just naturally encourages adherence.
Right. You can't just, forget to take a pill at home.
Exactly. The structure itself supports consistency.
And he felt it went beyond just showing up, that it helped with openness, transparency.
Precisely. Those regular touch points, face-to-face, they allow for ongoing assessment, right? Patients can talk about what's working, what's not. It just makes for a more open relationship with the whole team.
He even shared that really interesting thought, something like, sometimes I wonder if patients come more for the therapeutic environment than the treatment itself.
Yeah, that says a lot, doesn't it?
It really does. It highlights how much that whole atmosphere matters. The welcome, the staff interaction.
It's the whole package.
Yeah.
It suggests that feeling supported and comfortable can be, well, almost as therapeutic as the intervention itself sometimes, a really holistic view.
Okay, so we see the path to TMS, but let's back up a tiny bit. What got him interested in mental health in the first place? What was the initial spark?
Well, he mentioned a couple of things. First, his mother was a social worker.
Ah, okay, so it was kind of in the family, an early influence.
Seems like it. Seeing that work, the importance of helping people in the community.
Makes sense. Anything else?
Yeah, he said something clicked during nursing school. He realized psychiatric nursing was, well, challenging, definitely, but also incredibly fulfilling.
So the challenge appealed to him, but also the potential impact.
Exactly. That mix, the intellectual side combined with, the chance to make a real significant difference in someone's life, that connection really resonated.
That connection theme keeps popping up, making a positive change.
Yeah, I think for many in the field, that's the core motivation, isn't it? Seeing people get better, supporting them through really tough times, it's powerful.
So bringing it back to TMS now at the Goodwin Health Cafe, what does he enjoy most about having it there, using it?
He touched on a few aspects. He really likes the in-office visit model, that regular contact.
Okay, we've heard that consistently. What else?
Being able to offer more options,
Yes. Good.
especially for people with treatment-resistant depression,
Yeah.
those who haven't had luck with standard medications.
Right, giving them another avenue. And the fact that it's not medication seemed important too.
Very much so. He mentioned being genuinely fascinated by the TMS technology itself, how it works, and he really values offering an effective treatment that doesn't involve systemic drugs. For patients who maybe had bad side effects before or just prefer not to take daily meds, that's huge.
Yeah, a totally different approach. Offers a different kind of hope, maybe.
Exactly.
Okay, so practical question then. There are different TMS machines out there. Why did he land on the Blossom TMS device specifically?
Good question. It seems like it came down to some very practical points for his clinic.
Like what?
He said the Blossom machine is pretty compact and, importantly, easy to move around. For a smaller office space, that matters.
Yeah, logistics. Okay.
Also a big one, no special electrical setup needed. That simplifies things quite a bit.
Right, less hassle to get it up and running.
And just the overall simplicity and user-friendliness of the device itself were major pluses for him.
So it sounds like he did his homework, compared different options.
Definitely. He researched, looked at other machines, and decided Blossom was the best fit for his practice's needs at the time.
Makes sense. So thinking about other providers, maybe clinicians listening who are considering TMS, did Nicholas offer any advice?
He did, yeah. Some really practical tips. One I thought was great was his suggestion to actually visit clinics that use multiple TMS machines,
Oh, interesting. Why multiple?
to see them in action, side by side potentially. And crucially, he said try to do it without the sales reps there.
Ah, good point. Get the real unvarnished view from the people actually using them daily.
Exactly. See how they work in a real clinical flow.
What else?
He stressed investing the time and, the money to really understand the technology, not just how to turn it on, but the nuances of applying it effectively for patients.
So education is key. Don't just buy the box.
Right. And also check the local landscape. State regulations, insurance policies regarding TMS, those can vary a lot and really impact access.
True. Need to make sure it's feasible from that angle, too.
And finally, he recommended talking to other clinics, peers who have experience with different machines.
Why is that peer-to-peer advice so useful?
Because you get the real-world scoop, right? What
Oh.
challenges did they face? What successes have they had? What would they do differently? Learning from others' experiences is invaluable. It builds that sort of community knowledge base.
Absolutely. Okay, so looking ahead, what are his hopes for the future of mental health treatment? Where does he see things going, or where does he want them to go?
He definitely expressed a desire for more innovation, moving beyond just traditional medications.
Okay, like what?
Well, he specifically brought up the potential of psychedelics. He finds that area really interesting.
Yeah, it's a hot topic right now.
It is. He suggested they might offer unique benefits, things maybe not captured by our usual ways of measuring treatment success.
Interesting. So thinking beyond just symptom reduction, maybe, looking at broader well-being.
That seems to be the implication. It reflects this growing idea that we need to be open to different kinds of approaches, things that might work in different ways than what we're used to.
And it sounds like he's committed to keeping up with that, adopting new things if they prove effective.
Absolutely. He wants to provide cutting-edge care, to bring in new effective treatments as they become available and validated.
It really sounds like Goodwin Health Cafe is aiming to be on the leading edge of this stuff.
Yeah, that dedication to learning and adopting new approaches really comes through. It's all about finding what works best for patients.
Well, this has been incredibly insightful. Really appreciate you walking us through Nicholas Goodwin's work and his perspective on integrating TMS.
Yeah, it's a great example of the innovation happening in mental health care. Really encouraging.
And for you listening, we hope this deep dive gives you a good sense of how mental health treatment is evolving, especially with non-medication options like TMS gaining ground. Thinking about what Nicholas said about innovation, psychedelics, maybe even needing new ways to measure well-being, what other new approaches do you think might hold promise, and how do we figure out if they're truly making a difference? Definitely some food for thought there.